Oh, I had to do that. Yes, Hades cups. Why did that? No. There it is. 39th. Everything is good over there? Yes. Nice.
We did it!
Black ones too, huh?
Come on! Come on! Heal!
There we go.
Nothing to it.
Do I need to be using Divine Res right now? Yeah, I probably just should.
This is it.
Oh, Chameleon's here. Oh, weird. Color Chameleon shows up in the Coliseum. Oh, question. Oh, cool. Is not brushing your teeth before bed that bad? Oh, this is a very good one as far as like a question. Oh, and Troll's back. Hey, what's up, boy? So, Fan I am. Or I'm just gonna call you I am. Is not brushing your teeth before bed that bad? So, but it depends on what your diet is mostly. So, if you kind of think of it, you're about to go to sleep. You're about to spend 8 hours with your mouth either closed, best case scenario, open, kind of worst case scenario, but no matter what, you're sleeping and the organisms, the little bacteria in your teeth are actively ramping up production at that moment. So it's best to kind of get your teeth clean to like a neutral state. But here's the strat. If you ever wanted to min-max actually like what's the best time, if I'm only gonna brush my teeth once a day, when's the best time to do it? Do it right before you go to bed. Get your brushing on, get your flossing on, get your mouthwash, get everything, just lay the field clean at the beginning. Don't drink anything don't drink or eat after that. If anything, throw some water back if you need to. But when you wake up in the morning, you know how a lot of people are like, oh, I don't like that morning breath. Well, if you did a really good job before in the night, at night, in the morning, all you really have to do is kind of rinse your mouth out with water and then just go on with your day. That's enough for you to be able to have a nice straight 8 hours, if you're getting an 8-hour night of sleep, to be nice and clean, and the rest of the day can accumulate your plaque buildup, your food that gets lodged in between your teeth and such. So if you had to choose between morning or night, do a good job at the nighttime, you'll have a good time in the morning. Mouth open and closed while sleeping, that affects teeth hygiene. It does. Kind of think about that as far as like you have your mouth closed, so one or two things is happening. You're trapping all that bacteria in there, sweet, and you're also salivating throughout the nighttime, so you're creating this kind of mouth washing sensation that's going on your teeth, and because you're salivating and washing the teeth with your saliva, you're swallowing it. Best case scenario, that's good, but it also leads to some other things to happen too. Let's go and talk about the open mouth. If you sleep with your mouth open, essentially you're just breathing. What's happening is you're having this rush of air that's going in and out through mainly your mouth, but sometimes your nose too, and that rush of air is going to be drying up a little bit more of that bacteria that should have been washed, self-cleaned on your teeth, and to dry it up to start like attaching to your tooth, because the bacteria that is in your mouth is always going to be there, and your saliva actually has minerals that leak out as it goes into your mouth, so you're kind of hair drying or fast drying this bacteria and these minerals so that they stick onto your teeth like a barnacle would be stuck to the underside of like a boat. And so at that point, if you notice that if you look behind your teeth on the lower anteriors, the tongue side of the lower front teeth, that's a spot where a lot of people get calculus or tartar buildup, and that's a few things, but one of them that's a massive one is mouth breathing. What's the degree of coffee and wine affecting your dental health? So we kind of look at a couple things, because as far as like coffee and wine, the worst case scenario is that they're just going to stain your teeth, and what we call that stain is extrinsic stain. EX, kind of like exit on the outside. That means that you just have this surface level staining that happens from tea, from coffee, from dark sodas, from wine, and that can be taken off. That can actually be usually self-cleaned at home if you were to use an abrasive toothpaste. So a lot of times those whitening toothpastes have two actions of being able to help whiten your teeth, either a chemical action or it's going to be an abrasive action, and whichever one that you choose, you can do that at home. And even if you don't have like a special whitening toothpaste, if you get a little bit of baking soda that you'd usually go and bake a cake with or something, and you just go drizzle a little bit of that powder on your toothbrush, doesn't have to have anything on there, just water and baking soda and brush, that's enough to be able to usually abrade or scratch away that surface level of stain to your teeth. But as far as like how much harm it's going to be doing, if you drink like black tea or a lot of teas, they actually have fluoride in them. If you make your coffee, if you're making it from the tap water or if you're making it from a bottled water, check and see. There's probably a little bit of fluoride also already in your water source that you're going to be using to make that tea. Wine's a little bit different though, because that's going to be a certain filtration process, but it's not going to be something that's worse for your body, unless there's a lot of sugars in there. Then of course anything sugary is going to go and try to mess you up. But coffee and tea, if you need it to function, that's completely fine. Coffee is a diuretic, so it makes you regular, makes you need to go poop, because it makes it so that your digestive tract has a peristalsis movement where everything's like a wave-like movement, and it just makes it wave a lot more faster, making you go to the restroom a lot more often or quicker. But yeah, good questions. Very good questions about that. Question, just wanted to know, does your teeth get affected faster with darker colored drinks like Coke, coffee, teas compared to Sprite, carbonated water? So, I mean, every one of those that has that sugary action behind it. So, like we mentioned, dark sodas, even clear sodas, like you mentioned, Sprite and such, they are gonna go and do the regular thing that sugar always does. It puts that food environment for that bacteria to create acid that makes cavities in your teeth. Carbonated water is actually on the other end, where it's okay to have, but some people don't like it because carbonated water takes I think CO2, and it takes it and bottles it up and puts it in this water, and CO2 is not a good thing for you because that's something that you exhale, and somehow they're getting that and packaging it, whatever. carbonated water is a really good way to be able to work on all your dietary health. So just ridding yourself from sugars by still having that fizzy, familiar feeling that usually people kind of can be addicted to. All sodas are the same at the end. Yeah, all sodas are the same. The only thing that would change is how much stain. That's the only thing. But like I mentioned, stain is an aesthetic, a beauty thing. So if you have really stained teeth, doesn't mean that you have really bad teeth. Doesn't mean that your teeth are in really bad shape. It's just a stain that's on the outside layer. Different when the stains are on the inside, which is called intrinsic stains, but those tend to be things where your teeth are stained from systemic issues, such as like tetracycline stain. That's one where if a pregnant mother takes tetracycline while they're pregnant, which tetracycline is antibiotic. A lot of times it's used for skin and such. That tetracycline will affect the fetus's growth pattern and will cause their teeth to become what's called a candy corn stain. And I'll actually bring that up because it's always a cool one to. The tetracycline stain is a neat one to see. Tetracycline stain teeth. And I'll bring it up on stream here, but we call it candy corn stain because it has a multi-layer color-like look to it. And let's see if I can bring it up here. It does work. Sweet. So, like I mentioned, tetracycline. It's like I mentioned, it's a intrinsic stain caused by a medication that was introduced to the DNA or the body into the body while it was still growing. Tetracycline's not bad when it's taken when a person uses it for like external factors, but usually this is something that happens to like the child of a mother that's pregnant that takes tetracycline. But with intrinsic stain, because it is an inside stain, you can't just scrub it away. It's something that's kind of built in and throughout the tooth. Another one that would be like an intrinsic stain like this would be like a necrotic teeth. So a tooth that has died. Usually if a single tooth dies, it'll look like really dark, like one of these teeth, one of the darker areas, and it'll just be throughout that tooth and only that tooth. So you can kind of tell it apart as, oh, this isn't a systemically medicine-based stain. This is you got punched really hard, or you fell on your face, or whatever trauma induced. Yeah, that's kind of there's a couple more types of stains that would affect your teeth in this manner, such as like smoking. Smoking can be an outside stain, but it can, if you have cracks or craze lines in your teeth, that smoke stain can go inside of those cracks and create really deep stains. And so that's kind of a harder one where it's like we can't really just buff it out, but if we drill it out, then if the dentist was to drill it out, then you can get some relief that way. Good questions though. That is good questions. And that was weird. Let me know if I'm actually back and live. For some reason my OBS crashed on me. Just want to do a test. Can I type test? Am I back? So what are you called as far as the as dental field? Let me check my phone. Let me see if I can. Oh, okay, sweet. I am back. Sorry about that. OBS crashed and I freaked out for a moment. I was like, what the hell happened? All right. So what am I called as far as dental field? So I am. I have been a few things in my 15 years of time of doing dentistry. So to begin with, I'm a dental assistant in my state. I got in my further education and got a license, so I'm a registered dental assistant. And then I did that for 15 years or so. I even taught it for 7 years. And now I'm a dental laboratory technician. So where before, as a registered dental assistant, I was side by side with the dentist, helping them with procedures, seeing the patient has a good time, taking their x-rays, taking impressions, all the good fun stuff that you guys hate about us. But now I'm a laboratory technician, so now I make dentures and removable appliances for people's mouths. So if you got teeth that are missing, like straight up missing, not just like broken or whatever, I would be the one to make that replacement tooth for you, and hopefully you can go on about eating and doing all the other stuff that people that need dentures do. So that's kind of my experience in the field, is a fool that a fool that likes dentistry so much but not enough to become a dentist, because I don't like school. That's the reason. I just am not a school person, even though I taught for 7 years. Pop quiz, I like pop quiz. What can you tell us about George Washington's dental health? So in that one, I believe for George Washington, his dentist, I thought, if I can remember right, is Paul Revere. If I remember, his dentist was Paul Revere or John Greenwood. There's a couple, there's two names that pop up for that time frame. And those people and those specific individuals, Paul Revere, I believe, is the person that was like, oh, light 2 lanterns if they're coming by sea, or 1 lantern if they're coming by land. The British are coming type of deal. That dude was a dentist. And how was his oral health? I mean, the whole thing of he had teeth made of wood, I believe, was a farce, because I believe it was made of ivory. I think they used ivory to make his dentures, not wood. But don't hold me to that. Too far back for me to remember when I was talking to good old George back in the day. Now question, can sandpaper be used as a replacement for a toothbrush? Just kidding. My goodness. You say that, but remember, there's a time on this crazy timeline where people were sanding their teeth down with emery boards, essentially the same thing that you'd use to go and sand your nails to make them smooth, and they would sand their teeth, that like their canines or anything that was pointy, and make it flat, which is not natural to the body, but it's aesthetically, people can be tricked to be like, oh, that looks nice, everything's nice and flat. So there's some weirdos that are going and giving a good old 80 grit sandpaper to their teeth, and having probably a lot of sensitivity these days. So people say that. Another one that I had was this one fool went and wanted to whiten their teeth using a chemical method of whitening. And usually, to chemically whiten your teeth, a good start would be carbamide peroxide or hydrogen peroxide. But this fool used battery acid, and battery acid is so erosive that it just, I don't want to say melted, but it just eroded their whole top surface of enamel, the part that makes your teeth white, eroded it away. Because battery acid ain't supposed to be on your teeth. So, weird, but yeah. I read somewhere that has a place in Africa where these sticks chew on for dental health and whitening. They look like cinnamon quills. Yes, those are called the miswak. I believe they're called miswak sticks. They are really handy because they fray at the end when you chew on them. They fray at the end like a toothbrush would, and you can do really good work at that with it. Miswak, swak sticks. Damn, I'm good. Seawack. Thinking me swags. Seawack sticks. Yes, it is. I wish I had like one that it shows, but this kind of gets the idea. Yeah, they're super handy. Even here, you can find them at like certain ethnic stores, and you can even try them out for yourself. They have a little bit of a weird taste, but like I mentioned, they would just go and find this specific tree that would have these sticks, break off a piece, break off a couple for the family or whatever, chew it down and everything, get all these little frayed little toothbrush like tufts, and yeah, you just go and they'd have you bite. You can bite on it and pull it out. Kind of acts like a floss in a way, and you can see a lot of those African members and tribes that use this have really great teeth. One of them is because they're taking care of them with like the siwak or miswak, whatever sticks. Another one is that their diet doesn't include a lot of complex carbohydrates, sugars, and everything. So their diet already doesn't feed that bacteria that would cause cavities, which that bacteria that causes cavities is Streptococcus mutans, and it's always sitting in your mouth waiting for food, such as a sugar, like these gummy nerd clusters that I'm constantly snacking on, to just get introduced and cause havoc. Doesn't some cultures sharpen teeth as practice? Oh, I'm pretty sure that there are cultures that would do that, but a lot of times it will be like a cultural thing, and then you can even just say like the culture of media would favor more of a straight set of teeth. And like you would see a lot, I saw a lot in my Hispanic community, is that a lot of them will go and grind their teeth side to side so they can get a nice flat look, which is bad for multiple things: your TMJ health, your teeth health, and everything, and your VDO, your vertical dimension of opening, how wide you can open and close. It's not a good situation to grind your teeth in any capacity, but it is something that can be. It needs to be something that can be educated. People can be educated about.